Hello everyone, welcome to my channel. Today I'm going to talk about management of medical conditions. So in today's lecture, I'm going to cover topics about managing medical conditions such as congestive heart failure, myocardial infarction, cardiac arrhythmias, infective endocarditis, stroke, syncope, epilepsy, cerebral palsy, and a little bit about angina. And rest of the conditions I'll be discussing in tomorrow. So I'm sorry about the background noise. It will subside in a few minutes, I guess. So now coming to congestive heart failure. So what are the precautions that you take in a dental setting while trying to manage a patient who recently suffered with congestive heart cardiac failure or like congestive heart failure? So we have to make sure that if necessary only you're going to treat the patient, all right, and you have to always take the physician's advice on how is the patient's medical condition, and if you see any symptoms then you have to stop the treatment and limit epinephrine to 0.04 mg. Make sure that the patient is in semi-supine or upright chair position and never use retraction cords with epinephrine. Coming to myocardial infarction. So what happens in myocardial infarction patients is the patients are at higher risk of surgical and post-op bleeding. Okay, and always make sure that the chair position is semi-supine and discharge patients slowly to avoid orthostatic hypotension. So that, like, if you discharge them quickly, then there is a chance that they might feel dizzy. And patients suffering with recent myocardial infarction, make sure that you wait for 1 month to perform immediate dental procedures and at least 3 months to perform basic procedures. Now coming to cardiac arrhythmia. What happens in cardiac arrhythmia is there is disturbance of electrical rhythm of the heart, where you can see irregular heartbeats, decrease in heart rate, increase in heart rate, and cardiac arrest also. So how do you manage such a patient is you take local measures to control the bleeding, such as using topical thrombin or gelatin sponge, making sure that the appointments are short and stress-free, and consider limiting epinephrine to 0.04 mg. Always monitor the heart rate and blood pressure. Let me tell you something, for all different kinds of heart diseases, the patient suffering with heart diseases or had some conditions before, we always make sure that the treatments are short and stress-free. But in one condition where the patient is suffering with infective endocarditis, where the outer lining and like the endocardium is infected with the bacteria, in such conditions you make sure that you are doing all the procedures that are important for the patient at a go. It is not going to be a short appointment, it's going to be at a go appointment, because the patients will be on anticoagulants. So you have to stop the anticoagulants in order for the clot to form, right? So therefore, you're going to also place them on heavy antibiotics. So you have to make sure that you do all the procedures at a go. Now, endocarditis. So endocardium of the heart has itis. Itis means infection or inflammation. So there is a microbial infection or inflammation of the endothelium of the heart or heart valves, and it's mainly caused when the microorganisms are present in the blood. Management is by antibiotic prophylaxis, and you can schedule all the appointments in one day. I told you the reason, that is in the previous slide. And advise patients about maintaining oral hygiene, because if the oral hygiene is not maintained, there will be accumulation of bacteria and it will only worsen the disease. So always make sure that you advise a patient about maintaining good oral hygiene, and periodically control like the removable partial dentures, clean them properly, because or else there'll be accumulation of bacteria again. And before dental procedures, before all the dental procedures, 0.12% of chlorhexidine mouthwash needs to be used for at least 30 seconds. Now, conditions where antibiotic prophylaxis is no longer recommended are mitral valve prolapse, RH disease, bicuspid valve disease, calcified aortic stenosis, and congenital heart conditions. I'll be talking about in detail in my next class. Now coming to angina. Angina can be noticed there might be pain, or it can cause at rest where you wouldn't feel the pain. All right, here what happens is there is ischemia of the heart without necrosis. Ischemia means lack of oxygen to the heart without the death of the tissue, that is necrosis. And here it is of two types. One is stable and another one is unstable. In stable angina, it can be caused by stimulus. Unstable angina can be just caused at rest. So the treatment mode is, first you monitor the vitals, then you give oxygen, then you give nitroglycerin 0.4 mg for 5 minutes, you wait, and then you give the second dose for 5 minutes, and then you give aspirin. Aspirin is mainly given so that there can be prevention of the blood clot, and nitroglycerin is mainly given so that there is vasodilation and the oxygen will reach the heart easily. All right. And where do we have to use antibiotics in dental procedures? You have to use antibiotics where you're going to change, you're going to change anything around gingiva, or you're going to go deep and make any modifications to the periapical region of the tooth. In that case, you have to use antibiotics. And the dental procedures that do not require antibiotics are routine anesthetic injections of non-infected tissues, dental radiographs, and also the adjustments of orthodontic appliances. In case of molar band, we have to use antibiotics. So the exception is the molar band, and bleeding of the lips also we do not require antibiotics. Now coming to stroke, you can see the side of the face is different over here. There is drooping of the lips, eye is also like going towards, like there is drooping, and then like you can see the half of the face does not look normal. So what happens is, in the brain at a particular region, there is not enough blood reaching that part of the brain. Now, those patients are always having a high risk of post-op bleeding due to warfarin. So always try to manage post-op pain with acetaminophen. And if the patient has suffered with stroke, you avoid doing any treatments for 6 months. And we have studied that previously we have studied in this slide. Let me show you. So yeah, we have studied in myocardial infarction. What do? We can do emergency procedures after the patient has suffered with MI after 1 month. And if it is like basic procedures, we can do in 3 months. But in stroke patients, we do not do, and for 6 months at least. And schedule short, stress-free mid-morning appointments. Supine position needs to be used. And here also, never use retraction call with epinephrine, and limit epinephrine to 0.04 mg. Now, epilepsy, what happens in epilepsy is there is abnormal electrical activity in the brain, there is changes in the neurological function, their consciousness is altered, while involuntary movements can be seen, there is like uncontrollable seizures. All right, so what happens in these patients is, suppose if you see a patient who falls down, always make sure that, if it is happening during the dental appointment, make sure you're removing all the instruments, because these patients, when they have a seizure, they can be an injury caused by anything surrounding them. And always maintain a pillow below their head, so that there is a high chance they'll strike their head back and injure themselves. And always keep them towards the right side, like just make sure that, what do I mean by that is, if they want to throw up, they can easily, and they do not, the whatever contents like saliva or vomit is going to come out, it doesn't go in. And when do you treat these patients is when in their blood they have high concentration of anticonvulsant medication, then they'll be more calm. That is the point where you have to do your dental treatments. And the chair position is the supine chair position, and drugs used for the treatment of epilepsy is valproic acid and carbamazepine. Cerebral palsy is a motor function disorder caused by damage to the brain that occurs during fetal development, birth, or after first few months after birth. You can notice that this child legs are not in its like original position. They are, his gait is different, and then what all can you notice is abnormal walking gait, their speech is abnormal, and then there is coordination problems, so they cannot control their hand and arm movements. Now, how do you manage a patient suffering with any serious diseases? Is you always place the patient in semi-supine position, whereas CNS, you always keep them in supine position, but the exception is cerebral palsy, where you keep the position in, make sure that you always, you do not use supine position, you use semi-supine position, and you give a support to the head and jaw when necessary. Now coming to adrenal insufficiency. So what is adrenal insufficiency? It's also called as Addison's disease. So in Addison's disease, there is less cortisol. So if there is less cortisol, it leads to Addison's disease. So if there is less cortisol, you need to add cortisol. So add cortisol means less cortisol. Addison's disease means less cortisol. So that's how I remember AD. All right, so if there's more cortisol, then it leads to Cushing syndrome. So in Addison disease, there is a secondary adrenal insufficiency. Also, when do you see that is in hypothalamic or pituitary disease, or where the patient is being administered with corticosteroids. So when a person is taking steroids from an exogenous source, what happens exactly over here? Is the brain will think that okay, it's already, the body is getting cortisol, so there's no need to produce the cortisol. So then there will be a deficiency, there will be less cortisol, and then that will cause deficiency of cortisol, leading to secondary adrenal insufficiency due to the exogenous source of taking steroids. A normal physiological cortisol is 25 mg, but in a case of a stressful situation it can increase to 300 mg. So the management is short monitoring appointments with proper stress reduction protocol, and blood pressure monitoring is important. Now, what happens in syncope? Syncope, like a patient can just see the site of injection, white coat or instruments or blood, and like the body will immediately activate sympathetic nervous system, and then which directs the blood to the muscles. But as the patient is lying down, there is not enough venous return to the heart. The cardiac output is low and the blood that reaches the brain is less, and then the patient will faint. So if the patient is in about to faint, or you see like you see that there is the patient is feeling dizzy, make sure that you place the patient in Treadland-Burke position that is there in the first slide of today's lecture. I'll show it again, where you raise the legs, but you do not do so if the patient is pregnant. You use left lateral decubitus position so that the infant will not push and cause harm to the mother. Now coming to orthostatic syndrome, it occurs in a situation where there is extreme heat, and then you are going for your dental appointment where you're sitting on the chair for like a lot of time, and then suddenly you try to get up, you feel dizzy. That is called as orthostatic syncope, where your blood pressure suddenly drops when you try to stand up quickly due to the failure of baroreceptors reflex to mediate peripheral resistance. And in epinephrine overdose, you can see tachycardia, that is increase in heart rate and blood pressure, and it happens because of rapid intravascular injection. So always the dose of the LA needs to be calculated. So let me give you a quick overview. So we have studied about epinephrine overdose and syncope. I told you when there is poor cardiac output and blood that is reaching brain is less, there is syncope. And the main position uses Treadland-Burke position, but if the patient is pregnant, you use left lateral decubitus position. And in adrenal insufficiency, there is less cortisol. So it is called Addison's disease. And if it's more cortisol, then it is Cushing syndrome. And secondary adrenal insufficiency can occur due to the exogenous intake of steroids. Cerebral palsy occurs in children or infants or right after birth, where the gait is abnormal and then the motor coordination is not normal. And in these patients, you do not use supine position, but other than cerebral palsy, in all the CNS patients, you do use supine position. Now in epilepsy, make sure if a patient is going to, you see that is experiencing seizure, make sure that there is something soft placed beneath their head and you remove anything around them. And epilepsy is where you see abnormal electrical activity in the brain. All right, treatment for it is valproic acid and carbamazepine, and you treat these patients when they are taking the medication and in their blood it is at higher concentration. In stroke, that is when a particular part of the brain does not receive proper blood flow. In these kind of patients, you do not do any treatments for 6 months, and supine position needs to be used, and limit epinephrine to 0.04 mg and never use retraction cord with epinephrine. And in angina, it is mainly there is lack of oxygen to the heart without necrosis. Here you use nitroglycerin and aspirin. Infective endocarditis is the only heart condition where you treat all the dental procedures for the patient at a go, because the patient is on anticoagulants and you have to stop it when you do the dental treatment, and you're going to place the patient on a heavy antibiotic dose. So you have to do everything at a go. But other kind of diseases due to heart abnormal heart conditions, you have to make sure that the appointments are short and you do not do all the procedures at a go. In cardiac arrhythmia, you'll see like abnormal heart activity, and in these patients, you have to use short appointments and limit epinephrine to 0.04 mg and monitor blood pressure and heart rate. In myocardial infarction, there is an increased chance of surgical and post-op bleeding. Make sure that the patient is in semi-supine position and always discharge patients slowly. And you have to wait for 1 month in order to do any important dental procedures. And if it's basic procedures, please do not do it for the 3 months. Congestive heart failure, here also you have to limit epinephrine to 0.04 mg and never use retraction cord with epinephrine, and always make sure that if the patient is having any symptoms, stop the treatment, and always take um, the opinion of the physician before you start the treatment. So here on the right is the position which I was talking about, that is Trendelenburg position. And I hope you have understood everything about management of medical conditions. And I'll be talking about other conditions like diabetes, hyperventilation, asthma, airway obstruction, anaphylactic shock in my next class, that is tomorrow. And in case you want me to make any specific videos, do let me know. Leave a comment below and I'll be very happy to answer and make the video for you. And in case you're interested in the notes also, please do let me know. And if you have liked the video, please like, share, and subscribe. Thank you for watching.